thank you very, very much, one, to the selection committee, and two, for the health sciences and nursing departments for putting on this event. This is really great, and I mean, it's great practice for me to get up and speak in a room of people who care deeply about healthcare and the future of healthcare. So it's an honor to be here today. So, like was introduced, this is about competitive advantage of managing perception in care settings. So we're looking at a very macro topic. This is not as in the weeds as some of the previous talks. This is kind of over the next 10 years, there's a lot of literature about what might happen. And so we don't have hard data about AI and the future of healthcare quite yet. It hasn't happened. But this is going to be a research project, a paper, and it's ongoing about kind of where we're headed in a new direction of healthcare. And so as I talk about AI, we'll get to the point where I'm also going to speak on what's going to make AI valuable in the near future and why this advent of new technology will actually be meaningful in different contexts. So to get into it, there's a great debate in America, right? So the US commoditizes healthcare, right? We claim that healthcare and care in the United States should be a commodity, and there is this great debate over it. And I always say that I love to go to Providence College because my professors don't tell me what to think, they tell me how to think about things. So in what context is that bad, and what context is that good that we have this commoditization of healthcare? Well, when we're looking at the future in the next 10 years, AI, well, it's clear that America values AI very highly and new technologies very, very highly. And so I point out this on the map, right? This is a forecast of revenue for AI in healthcare in 2030. So we're 5 years away, and we're about 10 times as great an investment as most of our competing countries. So you're going to see in America that we will have the greatest and brand new AI development much faster and much clearer than our competing countries. And so if we view healthcare as something that should be competed for in different countries, which is debatable, and that's something that as we look at other discussions about access and about equality of care, maybe not the best system to commoditize it, but in a system where we want latest and greatest technologies, commoditizing actually, in this frame, helps for the AI discussion. So America's going to have the greatest innovation. We're going to have the largest investment opportunity, and we're going to see kind of hockey stick style growth on different charts. So I'll show us in a minute here some of those charts about the projections of our next 5 to 10 years. But I point something out though. So where are we right now? We're with a surgeon, and the surgeon is using robot assistant to perform surgery. So this is making incisions smaller. This is making an opportunity that we're going to see healthcare become largely outpatient. We're seeing personalized care plans because of AI and software. And the studies are showing that in the near future, we'll have preoperative, intraoperative, and postoperative care all surrounded by this AI technology that can consult surgeons during the process of surgery. So the surgeon can literally talk to an AI assistant and go, okay, I'm looking at this tumor and the margins are this. I'm not clinical, but the point is the AI will actually be able to give real-time advice based on other cases and a big data set of other cases to compare to. So that's where we're headed, right? This is super exciting. That means if I have to go to this hospital, I'm not just seeing one doctor, I'm seeing a huge database of doctors that have already done similar things. And the pattern will show in data recognition, and AI is going to really be able to synthesize this data down for a surgeon in action, but also before I get diagnosed and after I'm treated, that they can say, okay, here's what your post-care actually might look like based on people that have had similar care and cases to you. This is really exciting, and you know, I say I'm glad to be living in a country that's investing this much in this kind of technology, and our future's bright for this kind of care. So talk about a couple of data points, right? So North American robotic surgical procedures, the market size and the market share for America is huge. Like, it's a hockey stick investment, and you'll see more and more companies coming out investing on what they call the short end of the stick, which is here, and we're going to see in the next few years that the surgical robot market is just going through the roof. I mean, more and more hospitals are getting robots in their ORs, robots in their ERs, and not only are they going to help with surgery in the future, they'll actually help with diagnosis. So if you're thinking, okay, robotic surgery, fine, they're investing in that. Here's AI-based robotic surgery. And so you can see the investment in AI-assisted robotic surgery. And in 2020 is really when it started out with about $2 billion, but by 2030, we're gonna be about 5 times that investment. And our projections are only as good as tomorrow. We don't know what next big company is gonna come in and drop another $10 billion tomorrow. It's happening as we speak. And so I show these projections just kind of as an anecdote to where we're going. And nothing is super accurate right now because we can't predict the future. But what we can look at is where we've been trending. So what you might be concerned about is FDA approval, and I sure was. So I looked into this and said, okay, AI-assisted surgery, AI-assisted diagnosis sounds great, but is the FDA really approving it? And so here is some recent data that I could pull to say, yes, it is. The FDA is approving these things. So to briefly explain this, the FDA has put robotic AI-assisted surgery on a scale of level 1 to level 5. Level 1 being the baseline robot assistant, what we have right now. The surgeon is using robot with alongside the surgery to have smaller incisions, right? You may have had a surgery assisted by a robot. I know people in my family have. But it all the way goes up to level 5, which is full autonomy, which means the surgeon's not even in the room. The surgeon is just watching as the robot does the procedure and takes out the tumor, or replaces your knee, or replaces your hip. And the surgeon is no longer in the room. So at what point, we're not there yet, and at what point do we get there to say most surgeries, most elective surgeries will be at the point where it's fully autonomous? So in 2025, we're at a point where a lot of procedure is at level 3. So this is a conditional autonomy where the surgeon is in the room, but is actually not the one generating ideas. So the AI is generating potential strategies, allowing the surgeon to choose which strategy to implement, but then the AI and the robot is executing it independently. So the surgeon's there overseeing, but the surgeon has much less of a influence or has much less responsibility, not in a legal sense, but in a idea generation sense than before. And so, big picture, right? We zoom out and we say, okay, this is the trend. And I show these graphs to just establish a trend, not necessarily to be poked holes at, but just to say this is the way we're going. And so, big picture, when standardizing high-level care, high-level performance, expertise, that's going to be across the board. And so you think about when all these AI robotic is just easy to get and more accessible, because as more and more companies come to the United States and have these products, it drives price down, supply is driven up, which means more and more hospitals will be able to access these robots and these technologies. Price comes down, and I include a data point to say that there's a projection that says AI-assisted diagnosis, preoperative, postoperative, and intraoperative care, and surgical robots will save the US healthcare market $360 billion by 2030. And so we're talking about mass price drop and mass savings for the consumer. And so it begs the question, right? At what point do we get here at every hospital? Right, this is an image created by AI, but at what point do we get where the surgeon is just watching the robot do most surgeries? And you say, okay, of course, there's going to be surgeries that the robot will probably not do in our lifetime, and that may be true, but for the most surgeries, the most elective procedures, this is coming and fast. So at what point do we get to the point of something that looks like this, where the patient weighs clinical expertise less than the human connection? Because I could go to my local community hospital, I could go to a small hospital that has the same robotic healthcare, that has the same AI-driven robots in their OR that Mass Gen does. Hopefully soon that occurs and we get to a point where that's accessible for the local community hospital to have. And the projections for economists are projecting that could be so within the next 10 years. At what point do I, as a patient, weigh, okay, I could go to my local community hospital 5 minutes away from my house, or I could commute to Boston an hour away, get the same sort of care, but what do I weigh instead? And so this is my thesis, and it took me a long time to set this up, but what do I weigh instead as a patient? Well, the thesis is that you weigh the human connection. How well was I treated when I was at the hospital? Did the nurses and doctors look at me and respect me, respect my family members? Did they treat me with courtesy and respect? Did the front desk worker accommodate my family when they came in? Did the nurse call my wife when I got out of surgery? All of these things will be the future's differentiator for a hospital. And so the thesis is that the hospital that can do this best exceeds in a future of healthcare where medicine is more or less ubiquitous, streamlined to a point to say, a hospital that can't do these things effectively, care for me effectively, will not exceed over the hospitals that can. So that may be the differentiator in the future. And as our world gets filled with more and more tech, and as we see a streamlining of technology across all different sectors, not just healthcare, I'm going to be looking for the best possible connection to the humans around me, because I'm going to be so overwhelmed with technology that I want to go to the place that values me for a person and values the connection that we have with each other. So, taking a step back, right? I tell a story where I've been working at a hospital almost full-time for the past school year. I'm a junior in college, but I've maintained almost a full-time job. And my boss is sitting in the back, but I know, I have to say that. No. And so I got to experience quite a lot of what this care scene looks like in the hospital. And so I tell a story where this is a real story. It happened many, many times to me and my colleagues that I work with, where I walk up to the counter at an inpatient unit at the hospital, and I'm standing there, and nobody looks up from the desk. And I say, okay, they're charting, they're doing something clinical, they're caring for a complex patient. But I look a little bit closer, I wait for another few minutes, and nobody's made eye contact with me yet. There's 4 nurses sitting there. And I say, okay, what's going on? They're just, I say this kind of begrudgingly, but sometimes the case is they're scrolling on Facebook, right? And I don't say this to the point that nurses are bad or we should blame nurses. This is not the case, but this is a reality in the hospital where our nurses are checked out, they're disengaged, and there is mass disengagement. And I point to where? I point to our COVID-19 pandemic that has absolutely decimated our workforce to the point that our nurses are just checked out and they're disengaged in their work. And so how do we motivate our nursing staffs to a point where we can say, we want to bring back why you first started in healthcare? Let's remind our care teams and our caregivers of the mission that we took when we first entered the workforce. So I point this out, right? Why did we get to a point where our nursing staffs, our doctors are disengaged from their work? Well, if you look at skilled nursing workforce, it decreased by 5% in the first few months of COVID. That was a hard thing where many people left the workforce. By April 2022, just 13 months after COVID hit, we were down to 15.5% of our skilled nursing workforce. So you can imagine, not only are there less nurses to come in, you have to work 50 hours, 50, 60 hours in a week. Not only that, but you're also caring for not just 2, 3 patients, 6, 7 patients on your shift. And not only that, but your cases are much harder. A patient that's coughing comes in on day 1, and on day 3 they're on a vent. seemingly healthy patient that came into the hospital on day 1 is now an event on day 3. You're talking to them. You had a conversation with their wife. This is real. And so, yes, 3 years later, 2025 comes around, and where are we? Our nurses are just checked out. The pandemic may have passed, but it left us with a workforce that's disengaged and left it with traumatic experiences that they have to deal with. This is real. And so, right, there's expected 6% RN job growth in the field, but nearly 200,000 nurses are projected to leave the field in every year coming forward until 2033. So this is projections that we have to deal with. So what do I say is that AI will take some of that burden away from our nurse teams, from our physician teams, as they learn to leverage it and we train people to leverage AI. We're gonna see much weight lifted off our caregivers' shoulders as to, okay, automatic charting. You wear a little device on your shirt that listens to you all day and it charts automatically. I can walk into a patient room and not have to come back to the nurse's station and chart because it's done it. It automatically is putting that, these devices are out there. Silicon Valley, I mean, people are investing in startups all the time for these kinds of things. So again, I go back to the differentiator of the quality of medicine. If that gets streamlined, what's the differentiator? It's this quality of connection that we get to have with our patients. And so this is real, the research supports this, and my lived experience at a hospital says, okay, we just need now to reinvest our cash flow and our money in human capital, to say that we now need to recognize the problem that has been occurring in healthcare the last few years and put money towards it. And so I share a quote from a book, and you might have read this book by Fred Lee, and right, it reads, people do not do what their organizations expect, they do what their managers pay attention to. And so, what does that mean? It means that we have to train our leaders to pay attention to the good things again. We have to start to pay attention to the really good things that our nurses are doing, because the overwhelming amount of nurses that I work with are extremely compassionate caregivers who want to care and they want to be there for their patients. So we have to train them. We have to say, okay, RN that was thrust into a leadership position in 2022 because the manager retired, we have to give them that leadership training. We have to understand that this doesn't just occur overnight, that our leaders know how to lead a diverse team of people that work around the clock. We have to understand that, we have to invest in them. And so if hospitals want to be the differentiator in the future, this is the thing we have to start talking about, is that human connection will be the thing that patients weight more than medical expertise in the next few years. And so this is what it has to start looking like with every patient. And hospitals that start to recognize this level of care and leverage AI to do this effectively will be the ones to exceed in the near future. No longer will Mass Gen just be the top hospital in the world because they have the best technology or the best expertise. They will have to adapt as well to be the best hospital in connection, in compassion, and empathy, and respect. These are things that we at the hospital that I work at are tracking more and more every month. Our administrators are asking more and more about these metrics. They want to know how we're doing in these because they know this is what's going to make them competitive in the near future. And so as we look towards the future of healthcare, and I begin to wrap up, the point is that we have to understand where we're going. And so in this context of a highly tech-driven world, in this context of a highly, highly knowledgeable world, where knowledge is no longer acquired through 10 years of school, more so on the device that you carry around with you. It's true, this clinical knowledge will be accessible in the near future. What becomes the differentiating factor? What makes you competitive? It's how you can interact. Soft skills, respect, dignity, integrity, these things will be weighed from person to person much, much more in the near future. Thank you.